What's up, y'all? All right. Welcome back to the Cowboy and the Queen. Today, we're going to talking skin resurfacing. And if you've ever Googled lasers and felt, completely overwhelmed, y'all are definitely not alone, correct?
Absolutely, because every laser sounds like it does the same thing. And we all know that choosing the wrong one can lead to too much downtime. It can lead to pigmentation issues or results that just aren't really that long lasting.
And then, so that's why today we're breaking down the real difference between resurfacing options, including some of the most talked about lasers out there, and how to choose and fit what fits your skin. And like I said, I come up with a bunch of questions today that I want to learn about and ask you today too. So let's go ahead and just set the stage. What does resurfacing really mean?
So, resurfacing essentially is a controlled injury to the skin. And what that does is when we have a controlled injury, it causes collagen production and skin renewal. And that injury can come from heat, it can come from light, it can come from mechanical energy. But the outcome depends on how your skin heals afterwards, not just the procedure that's been done.
Yeah, so it's just not about the treatment. It's about recovery. About the recovery. Yeah.
Absolutely. The best results come from a smart injury and really strong healing afterwards, Wyatt.
And, this is something lasers are probably what people ask the most about. Is that correct?
Absolutely. So they are. Generally, lasers fall into full ablative, fractional lasers, or non ablative categories. And each of these categories depends on different depths and skin concerns.
And not everyone needs aggressive resurfacing. That's the thing. I think that's a huge thing. Your thoughts?
Absolutely. Most people don't. The old school rule of thought was the more downtime someone had and the more aggressive treatment someone had, then the better the results were going to be. And we have evolved a lot in this space, and energy and technology has evolved a lot in this space where we now know that, just because someone doesn't leave bloody or have 2 or 3 weeks of downtime does not mean they're not going to get really beautiful, long lasting results for sure.
And and this is why like today's we're gonna, dig really deep into everything because I think this is a really good podcast or episode for people that, who want to understand why certain resurfacing treatments work and which one, sounds the best.
Absolutely. And because skin resurfacing isn't about brand names, it's about wavelengths of light, depth, and thermal injury. And so it's how the skin responds biologically. That really boils down to, what lasers work best for each person.
So if y'all a provider out there, a patient, who wants the science, this podcast is for you. So when we're talking resurfacing, what's actually happening to the skin?
So, when we're talking about resurfacing at the cellular level, resurfacing creates a controlled thermal or mechanical injury that stimulates fibroblasts, neocollagenesis, and collagen remodeling. And so it causes that epidermal turnover essentially.
And then like the balance is injury versus inflammation.
Yeah, so exactly. So, too little injury means no results, but actually, too much, Wyatt, means prolonged healing and inflammation. And that can lead to pigment issues or pigment risk and even collagen breakdown instead of collagen remodeling.
Absolutely. So now let's do it. Let's break down the laser categories.
All right,
Talk to
let's
me.
go. All
Talk to me.
right. So, non-ablative lasers allow heat into the dermis while sparing the
hmm
epidermis. And then the ablative lasers are going to vaporize the tissue and actually cause, ablative lasers vaporize the tissue, and fractionated lasers are going to allow untreated areas to bridge to accelerate that healing process.
So is fractionation really what made resurfacing safer?
Yes, absolutely, it did.
So like, let's talk Halo. It's considered a hybrid laser, but what does a hybrid laser actually mean?
So, Halo is a combination of a 1470 nanometer non ablative wavelength, and it's combined with a 2940 nanometer ablative or erbium YAG wavelength for epidermal resurfacing, essentially.
So you're treating both pigment and collagen, correct?
Yes. So you are increasing the cumulative thermal load. And what this means is that's why the patient selection is super important because in order to get the results that you want and for it to be safe, the density matters. And it's not a casual laser that someone can come in and not have any social downtime with for sure.
Gotcha, gotcha. And then Moxie, it has become extremely popular in the field.
It is. So Moxie is a 1927 thulium laser wavelength. And so what this does is it has a high affinity for water. And so what that means is it's going to cause changes in that superficial epidermal layer, and it's going to help with pigment, and it's going to help with early photo damage, pore size, and fine lines and wrinkles.
So very little dermal penetration.
Absolutely. So it's great for those dyschromias, melasma prone patients, and it's really a preventative laser resurfacing. And it's not really designed for those deeper rhytids, wrinkles, or scars.
So where does Nuvaderm, which I love, 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 fit compared to Moxie, would you say?
So Nuvaderm is also a thulium, 1927 thulium wavelength, but the biggest difference is it has adjustable energy, density, and pulse width. So we can make the treatment a little bit more aggressive depending on how long the energy stays into the tissue and how deep we choose to go in the tissue and how hot we choose to go. So it is more adjustable and customizable than Moxie, which is just a set protocol that you can't change at all.
That's what I was saying. Is this more customizable? I sometimes say, and you can give your feedback on this, kind of like a Moxie and Halo had a baby in a way.
Absolutely. So what you'll see with Nuvaderm, and I have both in my practice, so I speak from experience, is that Nuvaderm is going to be serve a much larger patient population. So it's going to be more friendly to all Fitzpatricks of skin, being from lightest of light to darkest of dark. And your Moxie is going to be more reserved for your lighter Fitzpatricks.
Okay, so when you're saying like resurfacing, total resurfacing, what are we referring to?
So when we're talking about total resurfacing, we're talking about YAG or CO2 lasers that are designed to treat the deep dermis and severe texture issues and acne scars and things like those really deep vertical rhytids, or someone that has a bunch of sun damage or elastosis in the skin.
Mm-hmm, mm-hmm. And then these require significant downtime. I guess it just depends maybe how aggressive you're going, or
No,
what are you seeing? What's your thoughts?
well, with these more aggressive lasers, because we are intentionally vaporizing all the columns of the tissues and relying on that re-epithelialization process, these are more aggressive. And so they do have more downtime involved. And so that's why, skin prepping is very important. How hydrated someone is very important
Mm-hmm.
because some of these lasers are drawn to chromophores and some of these lasers are drawn to water. And so the patient is extremely dehydrated when they come in for a treatment and their skin is out of pH balance, they're not, and it has a lot of inflammation pre treatment, they're going to take longer to heal Wyatt. And that's really what causes practitioners not to sleep at night is when we have a patient that their skin is just not well prepped. And I think that's where practitioners have to really tell the patient if they're not a good candidate, the answer is no. Or if they come in for a treatment and they look dehydrated or they've been
Mm-hmm.
out in the sun, the answer is absolutely no. Because we have to make sure that we are offering safe treatments and make sure that the skin is prepped appropriately because how they heal, like you said earlier, is really the most important outcome. And that really is going to be how they get the best outcome is how they heal. And so it's not just the treatment that's done, it's, how they heal really does matter. So, Wyatt, as you know, and I think it's important for patients to know, is when a patient comes in for a laser treatment, there is some prep work that's involved, right? Just like surgery outcomes really involve the prep and the process of did they take their pre surgical vitamins? Did they start drinking alcohol? Did they not come in with a suntan? The same holds true when you're doing laser treatments. And so it's really important for patients' skin to be prepped and they need to be pH balanced and they need to be hydrated and they need to be ready to receive the procedure because then we find the results are much better. And also, their healing time is much shorter and effective if their skin is really prepped and ready for the procedure.
I 1,000% agree for sure. Um, so let's talk erbium.
Okay, so YAG or 2940 nanometer laser is extremely high water absorption. And so that's how that laser works. So some lasers work on the chromophores and some are attracted to water. And so when you're talking about an erbium laser, you have to have it has an affinity to water and it's drawn to water in the skin. And so It has a high water absorption, which allows very precise ablation with very minimal thermal spread. And so that is a very important procedure for the patient to be super hydrated for sure.
So less collateral damage than CO2.
Yeah, so it's your 1940 is going to be a lot less or moderately less downtime than a CO2 laser. It's going to have faster healing. It has less coagulation points essentially, and it also gets some skin tightening. CO2 offers some skin tightening as well, but your YAG is going to offer a little bit of skin tightening as well.
Awesome. And, and there's CO2, and I don't know, is it still considered the gold standard, or what's your kind of thoughts on everything?
Well, it's funny because I think CO2 has come a long way. When I first started in private practice many years ago, CO2 was the gold standard, but it was also one of the only options, right? And CO2 was super ablative at that time. There were not different options or different levels of ablation with CO2. And so, in that regard, the newer technologies do have different levels of ablation. And so someone doesn't have to come in and do the traditional old school CO2 where it was just you blast their face off, they leave
Right.
looking like raw hamburger meat, they bleed for days, and then they have uneven healing time. And what that means is like some of their skin would be intact, some areas might be a little bit bloody and oozy. And so what ended up happening was the skin didn't come off in a uniform fashion, so it had almost like jagged edges. So what jagged edges really mean with healing is that the more superficial layers would heal faster, those deeper layers where the laser went a little bit deeper would heal a lot slower. And so patients ended up with what's called PIH, or post inflammatory hyperpigmentation. And what this means is patients would stay red in those areas for much longer. So part of their faces might look really smooth and great, and the other parts might still be healing. And so I think there are newer technologies that are a little bit more cosmetically elegant. You'll hear me use that word a lot in this podcast, in the sense that some of these lasers now are designed where all the skin comes off uniformly. And so patients don't have those like hot spots, if you will. Even though CO2 is great and it leads to, neocollagenesis and tissue retraction and skin remodeling, I think that we just have so many options now that I'm not sure it is quote unquote the gold
Right.
standard.
Right. Yeah. I agree with you too. And I think it used to be like, you know, the more it hurts and the more inflammation I get and the more my skin, oh, that's going to be a better outcome. That's not the case anymore.
It isn't because some of these lasers, more ablative lasers, have higher risk. And so, what this means is, unlike old school thinking that hotter, deeper, more pain, more downtime was better, now we know that sometimes deeper, more aggressive just means prolonged edema, infection risk, hyperpigmentation concerns. And so, CO2 is definitely a laser that should never be chosen casually. And the patient needs to be prepared to have 10 to 14 days of like true
Hmm.
downtime and up to the healing time. When someone has some redness or a deeper CO2, I mean, they're going to have some redness even persisting for 8 to 10 weeks post procedure, Wyatt. And I think that's sometimes what people don't really talk about.
I did not know that. I was not aware of that at all. This is all freaking awesome information. So let's kind of jump and how does RF microneedling compare?
So, RF microneedling delivers thermal injury directly into the dermis with either insulated or non insulated needles, and they bypass the epidermis. So, someone can come in and have a microneedling RF treatment today, and then tomorrow literally look like they've had nothing done.
Mhm. And then, so is it better for scars and laxity?
It's going to be better. I don't think it's better for scars. I think it's going to be better more for pore size and fine resurfacing. I think you need something a little bit deeper and more aggressive to truly treat scarring. It is great for laxity, though. We see microneedling with radio frequency used all over the body, and it's really what we call our heavy lifter to help, lift crepey, loose skin on arms, abdomens, legs, buttocks, really anywhere, Wyatt. I mean, it's just one of our most versatile tools, I think, with face and body tightening.
So for scars too, I'm just jumping a little bit aside here. Like for basic your microneedling, do you think that works better for scars?
No, I think in order to effectively treat the scar, you have to really go down to the bottom of the scar. And I don't think that any sort of laser treatment alone is going to be effective when treating scars. I think you have to do a combination of therapies. We know that neuromodulators, things like Botox and Dysport and Daxi and Xeomin and Jeuveau, those are really effective in softening scar tissue in combination with lasers that really kind of go a little bit deeper. And then we also need to use lasers like BBL or IPL in order to take that color out. So a lot of times you want to affect the color, which is usually vascularity, and you want to affect the texture because it gets these ropey, waxy appearances that we have to really aggressively treat. Sometimes we even, if you're talking about acne scars, we have
Hmm.
to do what we call subcision, where we literally go in because a scar essentially, if it's not a raised scar, but it is a depressed scar, and we call those box scars or ice pick scars. Those are scars that are depressed. And so, in that situation, we have to go in and do subcision of the tissue with a needle. And then, what I like to do is then inject like a biostimulator, whether it's CAHA or selenosterma. Or something that's going to feed that tissue and build new collagen and elastin and neogenesis in that area. And then we also have to use lasers. So I really think like a sandwich approach is the most important when effectively treating scars, whether you're treating scars that are raised or scars that are depressed.
This is all freaking amazing stuff. Thank you so much, Missy. And there's another resurface category we haven't talked about yet, and this is nitrogen plasma. And a lot of people lump in their lasers or whatnot, but it's actually very, very different.
It is. So, I love nitrogen plasma, and I've had the opportunity to have 3 generations of nitrogen plasma in my practice. And I will tell you, nitrogen plasma is really in a category all by itself. And the reason for that is it's one of the only laser, it's not really even a laser, it's just
Hmm.
more of its own technology. Because with that technology, it's not targeting any chromophore and it's not a laser, a light based energy, but instead it's just ionizing nitrogen gas. And so, what happens when we do that is that it causes this thermal injury to the entire architecture of the skin, but it has this unique way of keeping the entire epidermis intact. And so, what we call it in my practice is we call it a more of a post ablative treatment. Because the beautiful thing about nitrogen plasma is you can completely remodel the entire architecture of the skin. They don't have any pain post procedure. They don't have any bleeding or oozing like with CO2 or erbium resurfacing. But that tissue stays intact and it causes what's called mins. And mins is where the tissue gets kind of a bronze glassy effect. And that tissue stays intact until it's really ready to come off. So it almost serves as a band-aid on the skin until the new skin underneath it is reepithelialized enough to be exposed. And so we like that because the patient doesn't have any pain. Then they don't get those hot spots that we were talking about earlier. And so this really is beautiful because what it does, it's a big deal when we're talking about risking the risk for that pigment that I was talking about earlier.
So no wavelength. I mean, and because obviously you can combine it with other procedures that you have, lasers and stuff. But like, wanted to ask, like, what is actually really happening to the skin? You kind of spoke on this when the nitrogen plasma is applied.
So when you have a nitrogen device that you take nitrogen and you add energy to it, what happens is you get this controlled thermal effect at the epidermis and the superficial dermis. And what that does is it denatures those proteins and collagen. And so what happens is we get this remodelization of the collagen or collagen remodeling without vaporizing that tissue like those ablative procedures do. And so that's why you get that post ablative effect where the tissue stays intact until that new skin is ready to come to the surface and reepithelialize.
Yeah, so you're heating, you're not removing.
Exactly. So the epidermis remains largely intact and it forms as like that biological dressing or that band-aid that I was speaking about before. And this is awesome because it keeps people from you don't have to worry about the risk of infections. It really does shorten that downtime compared to other traditional laser procedures for sure.
Where does nitrogen plasma shine clinically?
It's excellent for skin resurfacing as far as texture, fine lines, crepiness, moderate laxity, pore size, and it does cause that tissue retraction. And one of the reasons I think that's true is because when you're causing an injury to the entire architecture of the skin, that cell signal is repair more, right? And so then that signal is sent to the skin, you're going to get more tissue retraction and more tightening than you do with some of the other lasers. And so I think that's, one of the reasons it shines clinically is because you can get the skin tightening without having the aggressive laser resurfacing managing post procedure like you do with
Mm-hmm.
other aggressive
Mm-hmm.
laser
Mm-hmm.
treatments.
And skin types?
Because it's chromophore independent, it is safer for a lot of Fitzpatricks, especially those higher Fitzpatricks when used appropriately. And, through the right technique and the right of energy that we give to the patient, those still matter, but it can safely be applied to your darker Fitzpatricks in the categories that other
Okay.
lasers can't.
Okay, awesome. And then how does this compare to CO2 or erbium, would you say?
So CO2 and erbium reply on water and tissue ablation, and plasma delivers a uniform thermal energy without an absorption of coefficients. So it does not depend on water for
So
sure.
less risk of hot spots,
Right.
obviously,
Like I was
correct?
saying
Okay.
earlier, so potentially yes, especially when compared to, poorly executed laser treatments of any sort. But plasma doesn't give the same level of deep wrinkle correction as something like a CO2 laser, but they don't have the risk involved and they don't have the downtime either, Wyatt.
Yeah, that's exactly awesome. And the Pladue is often talked about, as a dual technology device. Thoughts?
So it's the only dual technology plasma device on the market in the United States. And the reason for that is it's not just a nitrogen device, but it also has argon. And argon is great if you're trying to treat acne, inflammation, or rosacea in the skin. Most of the other devices, or all of the other devices on the market, which would be Neogen Plasma, AgeJet, and Peladuo Pro, so AgeJet and Neogen Plasma are strictly and solely nitrogen-based devices. Pladuo Pro is the only device currently on the US market that is a combination of nitrogen and argon. And argon is great to treat skin conditions like rosacea, inflammatory
Mm.
acne, or just inflammation in the skin. And it's also good as an antiseptic or helping with bacteria in the skin as well.
So epidermal, dermal remodeling, and then treating other skin conditions.
Yeah, for sure. Pladuo Pro is great, but it's about respecting that the inflammatory load. And so, you know, we can combine treatments together. And I love stacking
Hmm.
nitrogen plasma with some of the other
Hmm.
procedures in my practice. But you do have to have restraint when you are stacking these energies together for sure.
So that's what I'm saying is like, where did providers get this wrong?
Overconfidence? I mean, I feel like when someone's not cautious and more cavalier, I think we can run into to issues because plasma still delivers heat, and when you have heat, that equals inflammation and too much energy, poor spacing, stacking with other aggressive treatments that can still cause that prolonged redness and erythema and potentially pigment issues as well. So, just not being too wild west with your procedures or thinking that more energy is better, just like we talked about in one of the last podcasts, too.
So safer doesn't mean safe for everyone.
No, exactly. No technology overrides poor patient selection. So, again, if your patient is a smoker, if your patient is on a lot of medications, if your patient is a sun worshiper and plays golf every weekend, if your patient lives in a state of dehydration, if your patient is diabetic, these are all things that you want to take into consideration when you're choosing a laser procedure for them because they're not going to heal like someone that
Hmm.
is healthier.
Yeah. And then how do you optimize outcomes after, plasma resurfacing?
Well, I mean, I think not just with plasma, Wyatt, but I think with all laser resurfacings, including plasma, I think inflammatory control and call is huge. And so we have to lower that inflammation. We have to keep the heat low, and then we have to really keep the skin hydrated. And so the way that we do this in my practice is we use, PRP, we use peptides, we use exosomes. We also help with proper hydration post skin, post procedure with appropriate skincare. And so if you have proper post care, that's going to help that re-epithelialization of the skin happen faster, and it's going to help the recovery be faster, and it's going to help their outcome quality even be better for sure.
And I know that I've seen this a lot more practices that are going into the more regenerative support side of things. So the plasma, it still benefits from the regenerative support, correct? Yes or no?
Always. So, anytime we do PRP, it really does lower the inflammation post procedure. Absolutely.
Awesome. So, like I said, we all, whether it's laser, plasma, RF microneedling, or just a combination, I mean, what's the goal?
The goal is strategic energy with intelligent healing and not just using the newest devices, but really choosing your patient wisely and knowing that, you have to treat the patient. Every single patient is going to be unique and make sure that your patient selection is good and learning when to tell a patient they're not a good candidate, even though they've seen it on TikTok, and really
Yeah.
educating them on why another procedure might be better.
This is where you really emphasize outcomes for the patient.
Right. So, like I said before, post resurfacing outcomes depend on inflammation control. It depends on your mitochondrial health, your collagen quality, whether you're doing those peptides or PRP or exosomes to modulate that cytokine response and fibroblastic activity. These are all things that put together make someone heal much faster and much more efficient
Better healing equals better collagen, correct?
every single time, Wyatt.
So what are the biggest technical mistakes you see in the industry?
I think excessive density, stacking multiple energy devices too closely together or on top of each other, ignoring Fitzpatrick's, and underestimating the inflammatory load, especially when you're dealing with perimenopausal patients.
Inflammation. Inflammation kills results, right?
Inflammation degrades collagen. That is the takeaway message. Yes, inflammation degrades collagen. We earlier talked about how to prep the skin for a procedure, we have to lower inflammation. So, in order to keep those results good, we have to keep the inflammation load low.
Gotcha. And then, like I said, if there's one takeaway um, that you would say from the technical side,
Choose an energy or resurfacing based device based on tissue response and not brand recognition, right?
respect the biology, right?
Always respect the biology.
That's awesome. Well, Missy, do you have anything else you'd like to say today before we sign off and get working on our next podcast?
No, I just think that any consumer out there that's going in for a laser treatment, really you need to prep your skin and take these procedures seriously. And the better well prepped your skin is, the better your results are going to be. And I really feel like if we're all on board in that regard and providers really prep their patients for not only prep their skin pre-procedure, but also really give them honest information about how long it's going to take them to heal, what their expectations are to heal. We all want to be the hero and we all want to have the solution, the best solution with the fastest outcomes. And sometimes that's just not realistic. You have to really be real with someone and not just try to be that short term hero. So I really think that, patient education is always
Yeah,
going to make a win win for both the patient and the provider.
I agree. If one patient has amazing result, they'll tell maybe three or four of their friends, and once again, you have a negative result, then they tell everybody.
100%, right? We don't talk about the good, we just talk about the bad.
No, exactly. Well, y'all, thanks for joining us on the Cowboy and the Queen of Aesthetics. And hope y'all have a great day. And hope y'all enjoyed this podcast as much as I did because this was super informative. And hope that y'all have a wonderful day. Thank y'all again.
Thanks for tuning in. We'll see you next time on Cowboy and the Queen of Aesthetics.
Bye, y'all. The information shared on this podcast is for educational and informational purposes only and is not intended as medical advice, right? The views expressed are based on personal experience, clinical insight, and current research, but they do not replace medical evaluation, diagnosis, or treatment from like your own qualified healthcare provider. always consult your physician or licensed medical professional before making any changes, whether it's your health, wellness, or medical care.